Welcome to StudyNeuro. In this session, we will discuss red flags in low back pain and learn how to recognize the warning signs that may indicate serious conditions, such as vertebral fracture, spinal infection, cancer, or Cauda Equina syndrome. These conditions are uncommon, but missing them can have serious consequences. By the end of this lesson, you will understand what red flags are, recognize the clinical features that require urgent attention, and identify neurological findings that should never be ignored, while also appreciating the strengths and limitations of red flags in everyday clinical practice. Clinical reasoning is essential. We will also develop a practical approach to deciding when urgent imaging, specialist referral, or emergency treatment is needed, and how to distinguish patients who require immediate investigation from those who can be managed safely with conservative treatment. If you find this video helpful, join the StudyNeuro community across our social media platforms for more high-yield neuroscience education and clinical pearls. Like, share, and subscribe to stay connected. Let us begin. Low back pain is one of the most common reasons people visit a healthcare professional, and in most cases, it results from mechanical problems affecting the muscles, ligaments, joints, or discs of the lower back, with symptoms that usually improve through conservative treatment. This is reassuring. A small number of patients, however, have warning features that suggest a greater risk of serious spinal or systemic disease, making early recognition essential so that timely investigation and treatment can begin before permanent harm occurs. These warning features are known as red flags. It is important to remember that no single red flag provides the diagnosis by itself. Instead, each finding should be considered alongside the patient's history, physical examination, and overall risk profile, because careful clinical assessment remains the most reliable way to identify serious disease while avoiding unnecessary investigations in patients with uncomplicated low back pain. Red flags are clinical warning signs that suggest a patient's low back pain may be caused by a serious underlying condition rather than a routine mechanical problem. Their purpose is to help clinicians recognize patients who may need further investigation, urgent assessment, or early specialist care before the condition becomes worse. Early recognition is critical. The conditions of greatest concern include cancer involving the spine, spinal infection, vertebral fracture, Cauda Equina syndrome, and progressive neurological disease, all of which can lead to serious complications if diagnosis is delayed, although they occur in only a small proportion of patients with low back pain. Careful evaluation is essential. It is also important to remember that a red flag is not a diagnosis. Each finding should always be interpreted alongside the patient's history, physical examination, and overall clinical picture, because sound clinical judgment remains the key to identifying serious disease while avoiding unnecessary investigations. Understanding why red flags matter begins with recognizing that most episodes of low back pain are caused by common mechanical conditions and improve without major medical intervention. Serious disease is uncommon. That is an important point. The main role of red flag assessment is to identify the small group of patients who may have a dangerous underlying condition, allowing timely investigation and treatment before permanent harm develops, while recognizing that individual warning signs often have limited ability to distinguish serious disease from more common causes of back pain. For this reason, no single red flag should drive clinical decisions on its own. Relying too heavily on an isolated finding can result in unnecessary imaging, unexpected findings that are not related to the patient's symptoms, increased anxiety, and treatment that may not be needed. Careful clinical judgment remains essential. Cancer is an uncommon cause of low back pain, but it must always be considered when certain clinical features increase the likelihood of an underlying malignancy. Early recognition is essential. Particular concern arises in patients with a previous history of cancer, unexplained weight loss, older age, or back pain that continues to worsen despite appropriate conservative treatment, especially when these findings occur alongside unexplained systemic symptoms, because this combination should prompt further evaluation for possible spinal or systemic cancer. Among all of these warning signs, a previous history of cancer carries the greatest clinical importance. It should always trigger a careful assessment and appropriate investigation to determine whether the spine has been affected by malignant disease. Spinal infection is a rare but potentially life-threatening cause of low back pain, and it should be suspected when back pain occurs with features that suggest an active infection or a weakened immune response. Prompt recognition is vital. The level of concern increases when patients have fever, a recent or ongoing infection, a history of intravenous drug use, immunosuppression, or recent spinal procedures, especially if the pain is severe, continues to worsen, or is accompanied by signs of systemic illness, because these findings may indicate infection involving the spine. The most important conditions include vertebral osteomyelitis, discitis, and spinal epidural abscess. These disorders can rapidly lead to neurological injury if treatment is delayed. Early investigation and timely treatment are therefore essential for the best possible outcome.
A vertebral fracture is an important cause of low back pain that should be considered when the clinical history suggests damage to the spinal bones, particularly in patients with risk factors that reduce bone strength. Do not overlook it. The likelihood of fracture increases after significant trauma, such as a fall or a motor vehicle collision, and it is also higher in older adults, patients with osteoporosis, those receiving prolonged corticosteroid therapy, or individuals with a previous fragility fracture, because these factors make the vertebrae more vulnerable to injury. One important point is that severe trauma is not always required. In patients with osteoporosis, even a minor fall or a simple twisting movement may be enough to cause a vertebral fracture, making careful clinical assessment and appropriate imaging essential. Cauda Equina syndrome is a serious condition caused by compression of the bundle of nerve roots at the lower end of the spinal cord, and it requires immediate recognition because delayed treatment can result in permanent loss of bladder, bowel, or leg function. This is a true emergency. The condition should be suspected when patients develop numbness in the saddle or perineal region, new difficulty passing urine, urinary retention, or loss of bladder or bowel control, especially when these symptoms occur with pain radiating down both legs, progressive weakness of the lower limbs, or other worsening neurological deficits. No warning signs should be ignored. Any patient with suspected Cauda Equina syndrome requires urgent neurological assessment and emergency spinal imaging so that definitive treatment can begin as quickly as possible. Progressive neurological deficits are warning signs that suggest ongoing injury to the nerves or spinal cord, and they require urgent clinical assessment because delayed diagnosis may result in permanent neurological disability. Time is important. Particular concern arises when patients develop worsening muscle weakness, increasing loss of sensation, symptoms affecting both legs, or a gait that becomes progressively unstable, especially if severe pain radiating along a nerve continues to worsen despite appropriate treatment, because these findings may reflect significant compression of the nervous system. These neurological changes can result from severe nerve root compression, compression of the spinal cord or cauda equina, or another serious neurological disorder. Prompt assessment and appropriate imaging are essential to identify the cause and begin treatment without delay. Progressive neurological deficits are warning signs that suggest ongoing injury to the nerves or spinal cord, and they require urgent clinical assessment because delayed diagnosis may result in permanent neurological disability. Time is important. Particular concern arises when patients develop worsening muscle weakness, increasing loss of sensation, symptoms affecting both legs, or a gait that becomes progressively unstable, especially if severe pain radiating along a nerve continues to worsen despite appropriate treatment, because these findings may reflect significant compression of the nervous system. These neurological changes can result from severe nerve root compression, compression of the spinal cord or cauda equina, or another serious neurological disorder. Prompt assessment and appropriate imaging are essential to identify the cause and begin treatment without delay. Red flags are clinical warning signs that help identify patients who may have a serious underlying cause of low back pain, but they are not diagnostic by themselves and should never be treated as proof of disease. This distinction is essential. Many patients report one or more red flags and still have uncomplicated low back pain. So a single feature, such as older age, should not automatically lead to imaging or other investigations, because the overall pattern of findings is usually far more informative than any isolated warning sign. Good clinical decisions depend on careful reasoning. Clinicians should consider how many red flags are present, how strongly they suggest serious disease, whether they fit the patient's overall clinical picture, and whether imaging is likely to change management before deciding on the next step.
The assessment of low back pain should follow a structured clinical approach that begins with a careful history and physical examination, because these steps provide the information needed to identify patients who may have a serious underlying spinal condition. Start with the basics. Once red flags have been identified, the next step is to determine whether they suggest a condition that requires urgent action. Since patients with progressive neurological deficits or features of Cauda Equina syndrome need emergency assessment, while suspected vertebral fracture, spinal infection, or malignancy should prompt appropriate imaging and an urgent diagnostic evaluation. If no concerning features are found, attention can then shift to determining whether the patient has nerve root pain or nonspecific mechanical low back pain. This stepwise approach supports timely diagnosis while helping avoid unnecessary investigations in patients with uncomplicated symptoms.
This brings us to the end of our discussion. The first step in managing low back pain is recognizing that most patients have conditions that are not caused by serious disease and usually improve with appropriate conservative care. That is reassuring. Some patients, however, have warning features that suggest a higher chance of significant spinal disease and need prompt assessment because problems such as vertebral fracture, spinal infection, cancer involving the spine, Cauda Equina syndrome, or worsening nerve damage can lead to permanent disability if they are missed. Early action matters. Even so, no single warning sign is reliable on its own, and each finding should always be interpreted in the context of the patient's history, physical examination, and, when appropriate, imaging studies, because careful clinical judgment remains the safest way to separate serious disease from uncomplicated low back pain. This approach improves outcomes while also reducing unnecessary imaging and treatment. Thank you for watching. If you found this video helpful, join the StudyNeuro community for more high-yield neuroscience education and practical clinical insights. You can follow StudyNeuro on YouTube, Facebook, TikTok, Instagram, and X. Please like, share, comment, and subscribe. See you in the next video.